Meeting is now being recorded.
Hello, and welcome to the 30-minute Greenhouse Overview presentation. The Greenhouse Project is a nonprofit initiative with Capital Impact Partners. Capital Impact Partners is a community development financial institution that works with organizations from both a lending and technical perspective to help people reach their highest potential at every stage of life. The first greenhouse homes opened over 10 years ago, and throughout that time, generous funding from Robert Wood Johnson Foundation has enabled us to create a proven program for deep transformation in long-term care that is outcome-based. The future of nursing home care is not about an us and them. We're building for what we would need. So as we're starting this presentation, think about what would be important to you now to live a full and meaningful life. Do you imagine that changing when you reach the age where you would need skilled nursing care? When we ask this question in presentations, people say things like, I would need to get outside, I need exercise, I need my pets, I need music. All those things that aren't necessarily tied to one's physical needs, but really just those simple pleasures that would help you and I live a full and meaningful life are those same things that our elders need. So take a moment to think about that and keep that tucked away as we explore the greenhouse model. Would you be able to have those needs met in this setting? So the greenhouse model was founded by a geriatrician, a doctor in upstate New York named Dr. Bill Thomas, who, when he was serving as a medical director in a traditional nursing home, was called into an elder's room who had a rash on her arm. And she said, Doctor, I have this rash. He said, oh, I know exactly how to treat it. He gave her the lotion and was ready to leave. When he was pulled down to her bed, she grabbed his jacket and said, but doctor, I am just so lonely. And at that moment, he looked into her piercing blue eyes and he was changed. He walked out and he said, you know, what is really plaguing nursing home residents today is loneliness, boredom, and helplessness. And so from there, he and his wife set about to develop a human habitat through 10 principles that became the Eden Alternative Principles that could live in a traditional nursing home setting. But he kept running up against the barriers of the long hallways, the double-barrel corridors, the roommates, the nurses' station. And he said, if I could just start over with a blank sheet of paper, what would that look like? And so that is where the greenhouse model was born. It was really to create an environment where the Eden Alternative Principles could thrive. And this model is really built to be accessible to all people. So it fits within the current regulatory and reimbursement structures. And what makes this transformation so comprehensive, so slip-resistant, is that it simultaneously transforms the philosophy of care, the organizational structure, as well as the environment and the architecture. And by bringing these three areas together, you are getting that deep, comprehensive change that results in outcomes, whether you're located in a rural setting, an urban setting, a suburban setting, or even on different types of campuses like the Veterans Administration. The greenhouse model is found across the country, like I said, on many diverse campuses. And we wanted to bring all greenhouse projects together under a common bond. What are those things that tie all of us together, even though they look very different on different campuses? And so we worked to develop 3 core values that, because they're simple, because everybody can relate to these 3 core values, they give us a stronger impact by giving us a louder voice together. And those 3 core values are meaningful life, real home, and empowered staff. So when we think about meaningful life, we really think about the idea, changing the philosophy to say that all people are creative, resourceful, and whole. And just as there is a childhood and an adulthood, there also is an elderhood, and this is a time of meaning and growth and development. We do this through some essential practices by placing decisions with the elder when possible or as close to them by people who really know them well, like the direct care staff and the family members. And by really knowing this person's whole story, we facilitate a sense of deep knowing that we know that Mr. Smith was a World War II vet and has 5 children and has deep ties in the community, and we can utilize that knowledge to create a sense of reciprocity. That elders are not only meant to receive care, but also give care. There's a back and forth relationship that adds value and purpose to create that life worth living, that continued connection to the community, and to really create days filled with being and doing that facilitates that meaningful life. The second core value, that of empowered staff, is possibly the most challenging of the 3 core values, but arguably the most important. So through empowered staff, we are working under the concept of elders rule. We're thinking about how can we place them at the center of everything that we do to really include them in the process of decision making. It's a strong change in leadership by really shifting from that top-down telling approach to a more flattened hierarchy of a coaching approach of leading, where we're balancing support with accountability. And it redefines the role of everybody in the greenhouse home, so that in one of our trainings, one of the clinical support team said, you know, I think that this really enables me to do what I went to school to do. It enables me to create those deep relationships and to practice my professional expertise, rather than in the traditional setting where sometimes other factors get in the way of that. So this model really hopes to bring us back to that professional expertise that is as close to serving the elder as possible. If you look at a traditional nursing home structure, you can see that basically it is a top-down pyramid-style organizational chart. In most cases, from my experience, the power sits at the top with the administrator. And so for any decision to get made, it has to be run up the chain of command. And so if a CNA, a direct care staff member that often has the deepest knowledge of the elder and their needs, wants to make a change or wants something to happen for the betterment of the elder, in order for that to happen, it has to go through multiple steps, and which is time intensive and often gets lost in translation. And another thing to note is that the elder is not even on the organizational chart of most traditional nursing homes. And so what does that say about their power to influence their life? In the greenhouse home, the hierarchy is flattened. The organizational chart looks much different. It looks more like a circle, with the elder at the center of that organizational chart to really show their power and their autonomy and control to influence those decisions that impact their life. The elder is surrounded by a group of direct care staff who, through many hours of training, becomes a versatile worker and works in a self-managed work team. They are called the Shahbaz, which is a term that Dr. Bill Thomas decided to bestow upon this role to connote a sense of respect and valuing. It's from a Persian legend of a royal falcon, which is called the Shahbaz, and whose role was to protect, sustain, and nurture the kingdom. And so, too, the Shahbazim in the greenhouse model protect, sustain, and nurture the elder. They work in partnership with the clinical support team. And this clinical support team, they bring their clinical expertise and partner that with the deep everyday knowledge and observational skills of the self-managed work team. And together, they create a clinical care team of excellence. So everybody is working in their scope of practice, but valuing each other's skill sets so that there is an equality, a sense of respect, and a sense that we are working together for the betterment of the elder, to help them to live to their full potential. The self-managed work team reports to the guide, and the guide is a person who can have a number of different backgrounds, whether they're an administrator or a social worker or an activities director, but they come with a deep knowledge of the regulations and also a lot of skills in coaching leadership. And through, by balancing support and accountability, they are able to empower, to create the conditions for empowerment of that self-managed work team to manage the household, but also the buck stops with them. They are the ones who ensure that that house is running according to the regulations, according to working with the self-managed work team to ensure that they are meeting budget, to ensure that that all those different things are happening so that the house runs smoothly. You see that there's also the role of the DON, which the nurse reports to the DON, as well as there is a medical director, as there would be in a traditional setting. Also, you see the role of the sage, and the sage is a person who, as that word connotes, a person who, by virtue of their age or life experience, has a level of wisdom and serves as that listening ear, that wise advisor to the self-managed work team. A CNA does not just become a Shahbaz overnight. A CNA goes through extensive training to become that manager of the household. And so over 200 hours of education go into equipping the leadership and the Shahbazim with skills to communicate, to coach, and to create sustainable systems for change. Because it really is a major shift in long-term care paradigm, and we want to be sure that everybody is equipped for success. The nursing role also changes dramatically in the greenhouse model. And this is something that over the years we really have worked on, because so much focus in the beginning was placed on that direct care role. And we kind of assumed that if you just shake up the other clinical roles and say, okay, now you're working in a real home setting and you're working in partnership with the direct care staff, go and do your thing, that it would just happen. And really, there needed to be a lot of intention around that, because the role does change so dramatically. And so the way that we thought about it was to think of home care and how a nurse would act in home care. And we also thought of these major roles that the nurse takes on, of being a care role model, a gerontological expert, a care partner, and a mentor and teacher to the self-managed work team, so that they really are able to become that care team of excellence and to continue to grow and develop in effective communication and skills. If you look here at the direct care staffing elders, this is something that you will work through with your project guide to see how the staffing makes the most sense in your setting. But basically, in a 10-person greenhouse home, it would be 2 Shahbazim during the day, 2 during the evening, and 1 Shahbaz overnight. And nursing staff would be 1 nurse between 2 houses during the day, and then between 2 to 3 houses in the evening. And this makes your staffing levels, compared to a traditional nursing home, on the higher end, but still within the averages. So the third core value is that of real home. And we work with you during the design process through a collaborative design approach to create an intentional space that supports meaningful life. Greenhouse homes are designed to look like a home in which an elder has lived in this community, and therefore designs can vary from place to place. If you look on this slide, you see the top home is a single-family home, and that's found in western Michigan. The middle home is one that is a suburban community in Birmingham, Alabama. And the third picture is of Leonard Florence Center in Chelsea, Massachusetts. So it's an urban setting. And each of these designs means home to the people that have lived their lives in that community. All greenhouse homes have private rooms and private baths. And when we describe greenhouse homes, we use the word warm, smart, and green. Warm means welcoming, a feeling of connection and belonging, and often this means a small space. We think that smaller is better. Smart meaning that we want to take advantage of the high technology that can really benefit both the workforce as well as the people living in the home. But we want to balance that. So we think of smart as being high tech and high touch. We don't want technology to be there as instead of relationships, but to just enhance and facilitate those relationships. And in greenhouse homes, green means growth. So when you think of green, think of just as in a one-word greenhouse, that's where plants thrive. A two-word greenhouse is where people thrive. And we're really working to create an intentional community, which means that you have a choice to have those connections with other people in the home, to honor individuals and honor their rituals, and really get to know people's needs and preferences and think about how that is going to work in your home. One way that we really highlight and further intentional community is through mealtime, which we call convivium, and that means good food with good people. In greenhouse homes, there's one large table as the dining room table, and this is a symbol of home and belonging. Everybody has a place at the table. And I'm just going to go through a couple of pictures of greenhouse homes. This is the hearth area. In greenhouse homes, this is really the central hub, that social space in the home. And there's a fireplace on one side and a kitchen on the other. So if you think about your home and where people hang out during a party, it's either going to be around the fireplace in the living room, or most people gravitate toward the kitchen. So we want to make that a warm and opening space. This is another picture of the hearth area. The kitchen all meets regulations or regulatory codes. We've done a lot of work with the NFPA to make sure that open kitchen is available, because we really believe that having the cooking in the home and the smells, that just normalization of the mealtime experience helps in so many ways. And so we want to make sure that the safety features are in place and that there is that warm and open feel there. This is a dining room, an example of that one table. And private bedrooms, where we really encourage everybody to be able to bring their own furniture and to decorate it to really have that warm feel, while still, again, meeting regulations, having beds that are accessible, or hospital beds where necessary. And in this case, they felt that it was really important that everybody should have a double bed if they wanted to. A really great story. This is from a greenhouse home in upstate New York, and they're embedded in the community. And when the delivery man was delivering these beds, he couldn't find the nursing home because it looked so much like the surrounding homes in the neighborhood. He finally knocked on the door and said, "I'm supposed to deliver beds to this address, but it says I'm supposed to deliver them to a nursing home, and I can't find it anywhere." and the executive director was able to say, you found it. This is what a nursing home looks like in Rochester, New York. Here's an example of the private bathrooms. Many greenhouse homes have the European shower so that it is easily accessible to people, whether they're in a wheelchair or not. And in greenhouse homes, every room has their own locked medication cabinet, and you'll work with your project guide to decide how to design this. Really important to include the nurses in that design process to ensure that it meets their needs. But this is a great way, especially for homes that offer short-term rehab, for elders to be able to be a part of their medication delivery experience and really understand what meds they're seeking. This is the den. Most greenhouse homes do have a den. Some use it as a family meeting space, or some people have a pull-out couch where family members can even spend the night. It's just another private space within the home for gathering. Easy access to outdoors. We like to ensure that each home has a easy access to outdoors, so whether it's an outdoor patio or a screened-in porch in the front, or in those urban models, a screened-in porch setting where elders are able to easily get outside. That also means that the doors remain unlocked so that they can come and go freely. And many homes have worked through that process in different ways to how to ensure that the outdoor spaces are safe, but also accessible to elders. In all greenhouse homes, they have the ability to have an overhead lift, and this is a feature that helps to facilitate meaningful life and also empower staff by creating a safe work environment for the staff members, for safe transfers, and also for elders that maybe in other settings would be bedbound, if they're able to transfer from bed to chair and easily go to the bathroom and have a shower. In greenhouse homes, there is a small space called an office, and this is where medication records are stored and where nurses can do charting if need be. This also meets the requirement to have a nurses station. We do want this space to remain open to elders and family, and also to be as small as possible so that people aren't spending any more time than necessary. It's a functional space. Greenhouse homes offer choice of bathing or showering by having a spa, and we really encourage greenhouse homes to think about how to make this space really luxurious and warm and beautiful. And so just as mealtime in greenhouse home is an intentional time and not just about getting calories, so too bathing time is a intentional time where elders are able to relax and enjoy that time. It's not just about getting clean, but it's about relaxing and how to enjoy those personal rituals. So the greenhouse home has been very lucky to have a close working relationship with Robert Wood Johnson Foundation and to have benefited from their grant funding. And at the beginning of the grant, Robert Wood Johnson challenged us to answer 3 questions. In greenhouse homes, are elders happier? Are they healthier? And are these homes financially viable? So through independent research and ongoing benchmarking, we've been able to address these questions. The first study was by Rosalie Kane, and she looked at satisfaction in greenhouse homes and also found that not only is quality of life, it has quality of life improved in greenhouse homes, but also the quality of care has improved. And another important finding of this study is that staff members were more satisfied with their time in greenhouse homes and that the stress levels decreased. And we also wanted to look at the workflow and that the time devoted to direct care time. And Shahbaz Sharkey explored this in 2011, and we wanted to know if the direct care staff were doing other things beyond personal care, could the Shahbaz provide as good of care? From doing this time study, we were able to determine that yes, more direct care time is spent in greenhouse homes than in a traditional setting. And not only this, that the time spent in transport significantly decreased because of the small and accessible space, and also the time spent waiting for meal times, waiting to go from room to room, waiting between events and activities, significantly decreased because of the flexibility to meet the elders' natural rhythms and preferences. But the fact with impact from this study is that there was 4 times more engagement than in a traditional nursing home. That elders and Shahbazim spent 4 times more time in these meaningful conversations. The third study to highlight is by Barb Bowers, a PhD nurse out of University of Wisconsin. And she was really looking at the relationship between the nurse and the Shahbaz and determined that clinical care was as good, if not better, in a greenhouse home because of those deep relationships, because there was that valuing of the elder's knowledge of the Shahbaz's elder knowledge of the elder, and because they were able to catch the stumble before it became a fall, to catch the sniffle before it became a pneumonia, and really found that nursing care was as good, if not better. These studies, along with other staffing studies, were able to be extrapolated to really understand the cost to the Medicare and Medicaid system. And there is good information to show that pressure ulcers significantly decrease in greenhouse homes, that rehospitalizations also significantly decrease. And these findings really have potential savings to the Medicare system and also an impact to the future of healthcare, those systems that are really we're starting to look at through the ACA, through other things, that there is potential impact. Because the greenhouse home has been around for 10 years, we really wanted to ensure that what we were creating had a resonance with the end user, with the caregiver, with that family member. And so we were able to do caregiver research. Through focus groups and surveys, we found that when presented with the greenhouse as an option, that 60% of caregivers would be willing to pay more for this option in their community. And that is so significant because we want to make sure that what you are investing in really has resonance with the customer. And not only that 73% of caregivers were willing to drive further so that you as an organization have a larger area to be able to draw from. Caregivers really understood that this model was not about a piecemeal approach, but really the value came from that comprehensive transformation, that they appreciated that through individualized attention from a low staff to elder ratio, easy to navigate home layout, small size to feel safe and to create that deep knowing, and the outside certification of the greenhouse project, that the staff training was so valuable, that comprehensive transformation of the greenhouse brand really created a value package for the caregiver. In our data-driven world, having a brand that is known for excellence in the field and backed by independent research is key to differentiate your organization. With over 200 hours of proven and practical educational programs, you are assured that you are implementing a sustainable and outcome-based transformation. Our expert project management guides your organization through the many facets of implementation, which save you both time and money. So working with us really takes the risk out of innovation, and having that peer network connection might be the most valuable part of working with the Greenhouse Project. Really having that, those monthly webinars and ongoing support and being able to share best practices with your peers who are also living the greenhouse day to day is so valuable to being a part of the Greenhouse Project. There has been a clear market response across the country that the greenhouse model is a solution to a lot of the challenges that we're facing in healthcare today. And when the Greenhouse Project is in the news, you are also in the news. We are able to give your organization a national platform to be able to tell your story. To date, there were over 160 greenhouse homes open and operating in 27 states, with many more in development. This is a growing movement that you are a part of. You're really investing in something that is bigger than yourself. You are a part of a national voice to change healthcare, to bring dignity and honor to elders, and a great place to work for that care staff. So to learn more about us and become more involved in the Greenhouse Project as you are implementing this wonderful model, we really encourage you to like us on Facebook, to reach out to us about the Connect groups on Facebook where you can have conversations that are role specific, to join the Peer Network website, to reach out to us. We'll give you a login and a password to get exclusive resources for your organization. There is also an app for the Greenhouse Project for iPad where you can take a look at 360 tours of other greenhouse homes, watch videos, and just gather some more information that you can easily share with others. This Maya Angelou quote really guides the greenhouse model. We did the best that we could with what we knew, and when we know better, we did better. And we salute you for the work that you are doing, the work that you have done, and as we grow and evolve together, how we can really best serve those elders and also the direct care staff that we work with. And I thank you so much for joining this webinar and look forward to talking with you more in the future.